Thank you. Madam Speaker, I've said time and time again in this House that we are tired of burying our children, especially our newborns. Vanatasia, unique, emerald green, was from Miskosipi First Nation. A life needlessly lost after CFS failed this mother, this family, but most importantly, failed her. I can't believe we have to wait for the 4 months for the medical examiner. It's far too long. We need to know today, what is this minister doing to ensure the safety of our children? Will they stop apprehending newborns?
The Honourable Minister of Families.
Thank you very much, Madam Speaker. And again, our condolences go out to the extended family, the caregivers, and all of those who have come in contact with this child. I have already mentioned that we know that the CFS agency, as well as the authority responsible for the child's care, are gathering information to find the family the answers that it needs. This is before the Chief Medical Examiner, and we will await the results of that report.
The Honourable Member for Kuwait-Nook on a supplementary question.
Vanatasia was placed under a foster care home run by BNL agencies. I am hopeful that this minister is familiar with that group's past. The mother said that she was not sure why CFS never gave her a chance to be a mother. A clear systems failure if the mother doesn't even know why specifically. How can she fix something if they don't tell her the why? CFS had months to act. They should have supported that mother while she was carrying instead of waiting for the baby to come. Madam Speaker, can this minister tell us how many babies have been apprehended immediately after birth, like this baby was, and more importantly, when will they enact legislation to stop this inhumane practice?
The Honourable Minister of Families.
Thank you very much, Madam Speaker, and I thank the member for the question. And of course, the apprehension of a child is the absolute last resort that is used, Madam Speaker, and we want to ensure that children remain in the hands of their loved ones and of those communities to the extent that they are, and we always have to obviously look at the safety of the child first, Madam Speaker, and we will continue to do that in our child welfare system, Madam Speaker. We have introduced our social impact bond, which is a doula initiative that we're going to be working with those mothers. The doulas will be working with those mothers to try and reduce that apprehension rate at birth. So we are taking steps and measures, Madam Speaker, in that direction.
The Honourable Member for Kuwait-Nook on a final supplementary.
Thank you. Minister, the department had apprehended 337 babies under a month old last year. This government spends millions on children in care, but many communities feel as though they are not receiving the support they desperately need. Many note the ridiculousness of the one-child, one-bedroom regulation used against our First Nations. Minister, would it be so hard to build homes in communities with the $550 million apprehension budget? Or, since I know this province loves to keep the kids' money, simply pick up any federal funding they left sitting?
The Honourable Minister of Families.
Well, thank you very much, Madam Speaker. Again, I thank the member for the question, and we are taking steps to ensure that children, to reduce the number of apprehensions of children. We will always put the safety of our children first, Madam Speaker, but we want to try and reduce the number of children who are apprehended at birth, Madam Speaker. That's why we have taken initiatives like the doula initiative, and we're working in those areas, Madam Speaker. We have also done a very comprehensive, the most comprehensive review of our child and family services system in Manitoba in 15 years. We receive feedback from communities about this, Madam Speaker. We will continue to work with stakeholders in the community to ensure that we reduce the number of apprehension of children in our province, Madam Speaker.